We begin the new year by visiting an ongoing issue facing our state, the opioid epidemic, a crisis that has claimed lives, funded cartels, and left families in turmoil. It's the first of our series, Arizona Addicted. Over the course of 12 weeks, Arizona Public Media will explore the solutions, stories, and science behind the ongoing opioid crisis in southern Arizona. Our coverage begins with a look back at how we got here.
The abuse of painkillers derived from drugs called opioids is an epidemic.
It's growing, and it's growing fast.
In 47 minutes, there was already 9 deaths.
But the opioid is something that nobody's seen anything like it.
As word spread about an epidemic taking hold of the country, by 2017, Arizona realized it too was in its grasp. A report from the Arizona Department of Health Services, or ADHS, found that in 2016, nearly 800 people died from opioid-related overdoses, on average about 2 people per day. Opioid prescriptions had also risen by 300% in the last 15 years. It led Governor Doug Ducey to declare an emergency in June of 2017, resulting in new prescribing guidelines, stepped-up data collection on suspected opioid overdoses, and more training for law enforcement on administering naloxone to reverse the effects of an overdose.
When there's an epidemic, when people are dying, then we have to act.
By January 2018, state lawmakers unanimously passed the Arizona Opioid Epidemic Act, establishing even more provisions in hopes of reducing opioid-related overdoses and deaths. From the onset, ADHS has been tasked with implementing many of those policies. I sat down with the department's director, Dr. Kara Christ, to discuss their impact.
We were able to set up real-time data tracking. We had never had that for opioids in Arizona, and we do that in public health all the time. We issued a opioid action plan, which had 12 recommendations for things that we thought if we could get, such as naloxone distribution, setting up emergency rules, setting up a opioid assistance and referral line, that we thought that would start making a difference in our opioid epidemic in Arizona.
Arizonans are still dying every day. One report puts it at least 2 a day on average. So how have you measured success thus far?
So a lot of the policies that have gone into place since the declaration, we have seen a 95% decrease in the number of opioid naive people who have been prescribed opioids. That is huge because that is a huge prevention effort. We know that a lot of people who have opioid use disorder never intended to use drugs. They were following a prescription that was given to them for a medical condition by their provider. And we know that if you're on it over 5 days, you have a higher likelihood of still being on that opioid a year later. So we worked with physicians. There's been a pain and addiction curriculum that has been set up and is currently being implemented in 70% of our undergraduate prescribing programs in Arizona. And we also hear that Florida, Minnesota, and a couple of other states are considering adopting Arizona's curriculum. We've also seen an increase in the number of naloxone doses that are being dispensed, but also being picked up by the pharmacy. So that was another policy that was put into place by the legislature, signed by the governor, so that if you have a loved one and you are fearful that they could overdose, you can go get the life-saving drug naloxone so that you have it on hand.
What's beyond the state's control? I mean, there are other people and other agencies that have stepped up or maybe still need to in this process.
Some of the challenges we're seeing now is Arizona is a healthcare workforce shortage area state in many areas, especially our rural areas. But there's not enough substance abuse treatment providers who can treat the population that needs to seek services. The other thing that we have noticed through our data is that we are seeing increases in fentanyl like we hadn't seen before. So now they're accounting for about 25% of the overdoses, when before it was like 20 cases. So we are seeing that with the rise in fentanyl and another rise in the number of people who have overdosed on 2 or more drugs. That counts for about 50% of our overdoses. So really starting to partner with law enforcement and show them the data that we have and what we're seeing, because Arizona hadn't seen that significant fentanyl use until about the end of 2018.
Are patients part of this equation when you look at solving the problem?
Yes, absolutely. So what we're trying to do is reduce the stigma that's associated with seeking treatment and getting help. Opioid use disorder is a chronic medical condition, just like treating your high blood pressure, your diabetes. It's going to be a lifelong treatment, but there is treatment available that is successful, and so really encouraging people to seek help when they need it.
This has been, a multi-million-dollar approach on behalf of the state. How long is it sustainable? I mean, where do you rate the cost moving forward?
So we always like to say in public health, while it will cost money to do that, you're saving people's lives. We have been lucky that we've received lots of federal money through federal grants, so the federal government has been providing a lot of money. The state legislature gave a $10 million what we call the GO-SUDS fund, so it's substance use disorder for people who are uninsured or maybe their insurance doesn't cover it, so that they can seek help as well. And a lot of entities and stakeholders have also put resources forward. We know that it took us many, many years to get where we are today, and it's going to take us years to get out of this.
Some communities are harder hit than others, and the resources aren't always there. And there's a county perspective as well. Is the state mindful of that as it tries this approach throughout the state, where it says, we know there's not enough resources in some communities?
So yes, and we know that every single county in Arizona is very different, their population, their environment. So what we try to do in public health is some of the grants that we've received from the Centers for Disease Control and Prevention, we've tried to pass that money down to our county health departments so that they can implement initiatives that they know will work in their communities. And every one of those has been very different. And so when you look at what Yavapai or Pinal is doing, that's different than what Maricopa is doing, but they're all targeted to their specific community.
I know this act really only came into effect a couple years ago, and it's not as easy as flipping and saying we're solved. But is there a timeline that you'd like to say, hey, by this point, this is what we'd like to see?
We would like to see a reduction probably starting within the next 5 years. It is going to take us a while before we can get there, especially with the introduction of fentanyl into Arizona. So we anticipate that it is still going to take several years.
Okay, Dr. Kara Chris from Arizona Department of Health Services, thank you.
Thank you.